My pre-reg year was quite different to how I expected it. From hearing from, older students who had gone through their year, they said it was very, very difficult. But really I found that I had quite a lot of support from all the optometrists there, and they helped you take each step and each exam at a time. And because you've been equipped with all the knowledge you needed from university, you were really just solidifying that rather than having to learn new things. So I actually found it quite enjoyable.
When you actually get into it, you realise it's not so daunting, everything comes step by step. It's not like they leave you in the test room and let you go just by yourself. It seems so far from where you are at university, but when you start pre-reg, you realise it's well within your reach and you're completely fine.
The most challenging part was being responsible for your own patients for the first time. Even though your supervisor was always there to check, you did feel that it was you and a patient in the room and their care was your responsibility.
I think probably juggling time was probably most challenging, because in university you have lots of free time which you can spend for studying, but working on top of studying in pre-reg is something that I definitely had to adapt to.
At first we were given sort of unlimited time, or an hour or however long, and they said just take as long as you need with your patient. Naturally that just started gradually coming down, and now depending on the complexity of the patient you can be quite quick.
You do have to keep an eye on it yourself. When I started I knew that I wanted to spend say 5 minutes on this and 10 minutes on that, and then I'd keep a clock near me that I'd just keep glancing at, and if I was letting myself overrun, then I would think, how can I change that for my next one, or why did that happen?
My first few visits, visit 1 and 2, were with the same assessor each time, which was good because you got to build up more of a relationship with them. They were very clear beforehand about what questions they were going to ask, or the sort of questions they were going to ask, and the structure that the exam would take. So unlike a university exam where you have no idea what to expect, it was very easy to prepare for the visits.
My first few visits, so visit 1, they do the 10 competencies. That was quite a quick one, and it was a brief looking at records and seeing how pre-reg would go. You sit down with your assessor and they basically help you arrange your hospital experience and that sort of thing. And then visits 2 and 3 are a lot more based on the actual competencies themselves, so you have a lot more that you need to assess. Timing's more vital in that one, and your practical skills are looked at a lot more heavily. Visit 3, usually for most people you'll go through your hospital experience in a lot more detail, and usually it's a tie-over of any competencies you've missed out in visit 2 and 1, and it'll just be tying everything up all together. Sometimes, and more often than not, people will need a visit 4, and it's not unusual for that to happen.
The OSCEs were quite scary leading up to them. It's sort of anything could happen in the exam through the whole of optometry, everything you've learnt. Felt that I was well prepared, and as you move through all of the stations and all of the rooms, you sort of calm down and it feels more natural in a normal situation with you testing the patient, and you just sort of relax and get into it, and it was all okay in the end.
It's not as nerve-wracking once you get into it. I actually sat mine twice. The first time I missed by 1 station, and I think it was really just the nerves that got to me, so I think if you stay calm, collected, then it goes a lot better.
It was interesting to know the weighting that different aspects of your examination had on the overall result. So communication was a massive part. Even if I was worried that I might not have got the correct diagnosis at the end, as long as I was communicating the tests that I was doing and the reasons for doing them, that got a lot of the marks as well, which was useful. The advice I would give myself if I was to go back through pre-reg would be to write down after each patient what you've learned. For example, if it was a new eye condition that you hadn't seen before, or you got some advice from another optometrist about how to manage that patient, and write it down and then read through it periodically, because you're likely to get a similar scenario again and you'll be more equipped to deal with it the next time.
I would say just be a lot more confident from the get-go, because a lot of the time you do know what you're talking about and you do know what you're saying because you've done the work and you've revised, but just putting it into practice you feel a little bit more intimidated, and I think just being confident makes the patient feel more at ease, it makes yourself feel more at ease, and things just come a lot more naturally as a result.
The new hurdles now I'm qualified would say the added responsibility of, you're not having a supervisor anymore. I'm signing my own prescription saying, I've done that test and the care of the patient is now solely in my hands. But apart from that, it's been the same as it always was.
I just qualified on Tuesday, so very, very new. It's definitely different. You do kind of feel that things have changed. You're a lot more independent when you work because no one's necessarily checking over you or flicking back through your records. So sometimes you do just need to kind of sit down and make sure that you're not missing anything out because there's no one to kind of hold your hand through it anymore. But it is really good as well to just finally have it all over and done with.